New today, COVID-19 is having an impact on all businesses, even those that are considered essential. News 5's Allison Zimmerman explains how some home healthcare workers have adapted during this pandemic.
For the most part, it's business as usual, but like most of us, home healthcare workers are taking extra precautions, and so are their patients.
I wake up, I get my bag out of the garage.
Gabby Aginaga's days seem typical for a home healthcare nurse, if there is such a thing.
Clean it off, get into my car.
But even as parts of her routine stay the same, it didn't take long for her to realize parts of her job have changed after all.
You don't go into the office. That has changed. Lord.
The office where Gabby's administrator Daniel Widener works, who sees the challenges her staff faces.
It's been tough. It's been tough. It's been stressful.
Widener says there have been some challenges for the home healthcare industry.
I'm not going to say that our business is booming. It's not.
With some of their patients not wanting anyone in the home, the number of calls nurses like Gabby go to have slowly shrunk.
A lot of fear in our patients. A lot of times we're the only people that they see.
And while Gabby hasn't personally seen a COVID patient, she says she definitely sees a difference among her patients.
One thing that I am doing different when I do take their vitals is kind of celebrate those moments when they don't have a fever. Like, hey, you don't have a fever, or
Interim Healthcare says they had their first COVID patient last week. The patient is expected to be okay. Still, clients are being screened prior to visits. Nurses are wearing masks and given additional PPE if needed, going into homes of those who may have been exposed.
I think one of the biggest misconceptions in home care is that our nurses and therapists are not on the front line. They are putting their patients first and their fears last.
Widener says they've also had to educate some of their clients on things like social distancing and isolation, but our clinicians are continuing to go on as normal.
I signed up to be a nurse and to help those who can't help themselves, and that's just part of the job,
And Widener tells me they've gotten a lot of support from the community, including restaurants offering to give meals to their workers, as well as having a yoga instructor offer a free yoga class just to keep their mental health in check. Always watching out for you, Southern Colorado. Allison Zimmerman, News 5.